Hello people, in this video we want to look at deQuerVain's TenoSynovitis. Okay, look at the word here. deQuerVain's, okay. TenoSynovitis. This is also called as some washerwoman sprain, mother's twist, etc. So basically what is this? This is TenoSynovitis. The name itself is saying TenoSynovitis. This is TenoSynovitis. And this is TenoSynovitis of the tendons around the wrist. So around the wrist, whatever tendons you have, it is the TenoSynovitis of this tendons around the wrist. Okay, so deQuerVain. So what is TenoSynovitis? First we need to understand that. See, every tendon, see they have shown a tendon, pipe inside is a tendon. Around it there is some sheath, that is the synovial sheath. Okay, so there is inflammation of this synovial lining which is around the tendon. So this becomes TenoSynovitis. Okay, this can happen because of irritation, or it can happen because of infection from bacteria, even tuberculosis bacteria, etc. Okay, so this is TenoSynovitis. So if it is of the wrist, the tendon around the wrist, then it is called as deQuerVain. Okay, deQuerVain TenoSynovitis, is that the way it's pronounced? So look at this, what will be there here? They will have pain, swelling over the radial styloid process. So they will have pain and swelling over the radial styloid process. Please touch your behind your thumb, right hand, please touch there. Okay, that is where deQuerVain TenoSynovitis you will have pain and swelling. What and all you will have? Pain and swelling over the radial styloid process. So where is the radial styloid process? You know, right? Look at this. So if your thumb is on this side, okay, imagine your thumb, this is your thumb, okay, and these are your other fingers. So this is your right hand, okay. So this is your right hand. So here you have the styloid process of the radius. This is the radius and this is the ulna. So here, this is where styloid process of the radius. Please open your right hand and in the line of your thumb, okay, the styloid process of radius. Please touch there and see. You will have, if you have any tenderness or pain. So if you have, it could be a deQuerVain's TenoSynovitis. So there will be pain, swelling over the radial styloid process. Okay, why can this happen? We told you, because of inflammation due to infection or irritation. What is the, which two tendons you should mention? The sheath of which two tendons, very important. The sheath of abductor pollicis longus and extensor pollicis brevis. These two are the tendons whose sheath has been inflamed. Which are the two tendons? Can you say APL and EPB? Can you remember at all? APL and EPB. So abductor, that means something that is bringing it, taking it away. Abductor pollicis longus and extensor pollicis brevis. Okay, say the name. Abductor pollicis longus, extensor pollicis brevis. Okay, very good, very good. So these are the two tendons whose sheath is inflamed. Okay, why does this happen? Exact cause they have not told you, right? So this is the cause because of the increased angle of the radial styloid process. So just blame the radial styloid process itself. The angle is more, it seems. Okay, so increased angle of the radial styloid process is the etiology they are saying for this TenoSynovitis. Okay. So on examination, what will you see? Tenderness on the localized to the radial styloid process. There can be difficulty in gripping. Okay. Then there is something called as Finkelstein's test that you will do. What test? Finkelstein test. Okay. So some people are telling you should make fist. Some people are telling you should just do with the fingers without fist. So anyways, what you do is you ulnar deviate the fingers. Okay. You ulnar deviate the fingers. Which is ulnar deviation? This is ulnar deviation, this side. For your right hand we are telling, and this one is for thumb side will become radial deviation. So what you'll do, you'll first ask the patient to ulnar deviate, okay, the finger. Then you will provide resistance, and then you will ask them to radially deviate. Whatever is ulnar deviated, give resistance, ask them to radially deviate, deviate. Okay, that time what will happen? There will be thickening of the sheath. Okay, this is about the fingers. Some people are telling fist. You make a fist with the see, the thumb opposition has happened, right? Not opposition, thumb flexion has happened of the thumb. You're making a fist, right? Then you have ulnar deviated. Now what you'll do, against resistance, you'll try to do radial deviation. That time what will happen? This palpable thickening of the sheath you can see. Okay, this is what is Finkelstein test. Finkelstein test, for what will you do? Finkelstein test, where will you do Finkelstein? The finger, Ulnar deviation, radial deviation. Where will you do? deQuervain's TenoSynovitis. Okay. Then, how will you treat this condition of deQuervain TenoSynovitis? Ask them to rest with crepe bandage or slab. Just ask them to rest it. Give some analgesics for painkiller. Ultrasound radiation may bring relief. This is some first time we are reading something like this, right? Radiation. Which radiation? Ultrasonic radiation, not those ionizing radiation. Just a ultrasonic radiation. And this sounds more like a physiotherapy to me, right? Ultrasonic radiation. Then you can give hydrocortisone infiltration. Okay, that is, you can inject it. Hydrocortisone, that is steroid. Then in chronic case, you may need to slit and excise a part of the tendon sheath. In chronic case, you just slit it, and this tendon sheath, whatever is there, you have to excise it, whichever is inflamed. Okay. So this is all about deQuervain's TenoSynovitis. Bye bye.